go ahead.
There's still much controversy regarding the use of stem cells in the world today. There's also promising research rising out of the debate. What are stem cells and where do they come from? What could they mean for persons suffering from spinal cord injuries, Parkinson's disease, or diabetes? Today we will talk about what stem cells are, where they come from, what they can be used for, and why this is such a controversial topic. So what are stem cells? Stem cells are cells that are undifferentiated, meaning they haven't decided what specific type of cell they are going to become. We can liken this to a lump of clay or a blank canvas. The potential to be anything is stored in the cell. If we go back to the basics of reproduction, an egg cell and a sperm cell unite and then divide millions of times to eventually become a fetus with thousands of different specialized cells. By definition, stem cells are required to have these two properties: self-renewal, which is the ability to go through numerous cycles of cell division while maintaining the undifferentiated state, and potency, the capacity to differentiate into specialized cell types. The practical definition of a stem cell is the functional definition: a cell that has potential to regenerate tissue over a lifetime. According to the National Institute of Health on Stem Cell Information, when a stem cell divides, each new cell has the potential to remain a stem cell or to become another type of cell that has a more specialized function, such as a muscle cell, a red blood cell, or a brain cell. And if I can direct your attention to our chart over here, this is a stem cell. And like we were talking about, one of the definitions for a stem cell is that it can either remain a stem cell, which is going to make more of the same cells, or it can differentiate. So it could become, for example, a fat cell, bone cell, or a connective tissue cell. Where do stem cells come from? 30 years ago, scientists discovered a way to obtain embryonic stem cells from mouse embryos. In 1998, a method to obtain human embryonic cells and grow them in a laboratory was discovered. These cells are called human embryonic stem cells. The scientists used embryos that had been created as part of the in vitro fertilization process, but had not been implanted and were no longer needed. The consent of the donor allowed the scientists to use them. In 2006, researchers made another breakthrough by identifying conditions that would allow some specialized adult cells to be reprogrammed to assume a stem cell-like state. These cells are called induced pluripotent stem cells. These cells are found in many parts of the body, including the brain, bone marrow, blood vessels, skeletal muscle, skin, teeth, hair, gut, ovarian epithelium, and the testes. These cells remain undividing until they are needed to maintain tissue or to replace specific cells that have been damaged by disease or injury. Stem cells can also be acquired from umbilical cords, and most recently they have been discovered in amniotic fluid.
What are stem cells used for? Human embryonic stem cells could possibly help cure many diseases. Some possible conditions that might benefit from stem cells are diabetes, heart disease, cancer, spinal cord injury, and genetic diseases. Human stem cells could also be used to test new drugs. For example, new medications could be tested on safety on differentiated cells generated from human cells that are capable of turning into other cells. These kind of cell lines are used already. Cancer cell lines, for example, are used to screen potential anti-tumor drugs. Another potential application of stem cells is making cells of tissue and medical therapy. For example, it may be possible to generate healthy heart muscle cells in the lab and transplant those cells into patients with chronic heart disease. Preliminary research in mice and other animals indicated that bone marrow stroma cells transplanted into a damaged heart can have beneficial effects. Today, donated organs and tissues are used to replace those that are diseased or destroyed. Unfortunately, the number of people needing transplants far exceeds the number of organs available. Scientists have been able to do experiments with human embryonic stem cells since '98, when a group led by Dr. James Thomas from the University of Wisconsin developed a technique to isolate and grow the cells. In October 2010, Geron, a biotech company in California, began enrolling patients in its clinical trial for human embryonic stem cell-derived therapy. This trial has been designed has been designed to test the safety and use of stem cells in the restoration of spinal cord function. Also, ACT, a biotech company in California, has been granted FDA permission to begin enrolling patients in clinical trials for retinal cells to treat patients with eye disease and age-related macular degeneration. Although embryonic stem cells are thought to offer potential cures and therapy to many devastating diseases, researching them is still in its early stages.
I believe that stem cell research is something that needs to have more time and money spent on it. There are a lot of good things that can be done with stem cells due to their ability to be replaced as any other cell, their ability to morph into any other cell. Some of the diseases that they can cure include Alzheimer's disease, spinal cord injury, stroke, burns, heart disease, diabetes, leukemia, and Parkinson's disease. They have also been used for drug testing in place of animals. As of right now, there's not a whole lot that's known about them, and there's a lot that can be done with them from what they've found so far. And that's why I believe they should spend more money on it. Back here we have some of the political cartoons that are pro-stem cell research. Okay. This one here, I'd rather die than allow stem cell research, the patient was saying to the doctor. The doctor replies back, funny you should say that. This one here talks about how stem cell research is pretty much everywhere except the United States. And this one here talks about taking 2 aspirin and praying for Parkinson's cure in the morning.
Okay, this is why I believe that stem cell research is a bad thing. Lab mice have been treated for Parkinson's disease with embryonic cells, and they have died due to brain tumors in more than 20% of the cases. And this is because embryonic stem cells that are stored over time have shown to create cancer cells by chromosomal anomalies. Another reason is that many people believe that embryos should not be used for stem cell research because it is a human being with rights. The other side of the spectrum says that the embryo is too early in development, so they do not have a moral status or interest of its own. And when ethics become involved, many oppose this research because it is against their religion or personal beliefs. Using stem cells for cloning has been proven to be unstable. Cloning with stem cells can cause fetal abnormalities, which can affect developmental growth. With politics, politicians are divided amongst this issue because those who are religious are against it and those in favor of science are for it. Recently, a privately funded Virginia fertility clinic wanted to start growing human embryos to harvest the stem cells, and by doing that, it kills off the embryo. And many are against creating life. Many are against creating life just to destroy it. When people or human beings start playing the role of God, it's something that scientists should not start doing. Obama recently signed a bill removing the Dickey-Wicker Amendment, signed into law by Bill Clinton, and this amendment states that this provision prevents federal funding for any research that harms or destroys human embryos, whether created through in vitro fertilization, cloning, or other means. Obama is in favor of cloning human embryos for experiments, and when scientists start cloning babies, who's to say that it's not going to stop? Scientists are too wrapped up with the possibility that embryonic stem cells could do wonders. It's been proven that they are too early of a development and cause unstable reactions or tumors in lab-tested animals. Over here we have political cartoon quotes that are against stem cell research. This one states that, I died waiting for embryonic stem cell research to find a cure. What about you? Well, I was the embryo, and it's a picture of an old man and a boy sitting on a cloud in heaven. This one is a picture of a baby in a womb, which he is saying, if embryonic stem cell research kills me before I wake, I pray the Lord my soul to take. We hope that we have broadened your knowledge regarding stem cells and their uses in science and medicine. This is a topic that has been passionately debated for decades and still continues to be a moral, religious, and political issue today. With all the groundbreaking research that has come to light in the past few years, it is unlikely that this issue will disappear. There are numerous questions that still remain. Who determines whether or not the benefits outweigh the controversy? If these persons that are so vehemently opposed had a family or loved one that would benefit from stem cells, would they change their minds? Let's hope the science will continue to make great strides in using stem cells to change the lives of so many who suffer from what are now thought of as incurable diseases and injuries.